Well, hi everybody and welcome. That was a very quick hello and goodbye from Jen, who is the educational consultant on the Maryland Deafblind Project, Connections Beyond Sight and Sound, who I'm sure you are all very familiar with. They do some killer work there in Maryland on behalf of kids who have both a hearing and a vision loss, the combination of both. We share the same interests and values and services for the kids. I am the director of the New York Deafblind Project. There is one of these grants in every single state. And we are here to provide support to children between the ages of 0 and 21, again, who have both hearing and vision loss. So all throughout this time that we have been in our shelter and home, a lot of us have been trying our hardest to provide as much information to the field as we can, in particular to families who are really having a brand new experience. I am a parent. I am a parent of 2 able-bodied children, and that in and of itself is challenging. So anytime there are some additional needs that present themselves, can really make us think differently and have to shift. And so I know Maryland, along with us in New York, have all been trying to bring information into your homes, into your home offices as much as possible, just to help expand our knowledge and strategies while we're in this particular capacity. So I happen to be the director of the project in New York, but I am also a nationally certified interpreter. So it's kind of a unique role for me, because most people who come into these positions come from a background of severe and multiple disabilities in terms of special ed providers, or they may be a teacher for the visually impaired, a teacher for the deaf is a little less common. But I had the good fortune of, I started my career, I started my academic career at Gallaudet. I did my master's degree there, but not in interpreting. It was in rehabilitation counseling for the deaf. And that's where I met the first deaf-blind person I had ever encountered, was at Gallaudet. And like many other people, hearing people perhaps as second language learners of sign language, you know, I was really so well or don't see it at all. So I remember very much feeling
Susie, you froze there. Oh, there you go. Now we're back.
See, 2-dimensional world, right? All right, are we good now?
Yes. Poor
Okay.
New York with their technical issues all the way around, huh?
Well, I hate to say it, you know, we're kind of at the end of a heat wave, and so yeah, all of our email has been down all day, and we're not even on campus, but being connected to campus. Anyway, all that to say, I think you missed it when I was saying that, you know, if you're a learner of sign language, which is a visual language that moves fast, the first time I met a deaf-blind person at Gallaudet, I was quite perplexed. It's like thinking the same thing that most people do. Well, how does that work? If someone can't see so well, or they can't see at all, how do they access sign language? So that was my first introduction. And then once I graduated with my master's degree, I went full force into the deaf-blind community and started working at Helen Keller National Center. So HKNC is the only national training facility in the United States for adults and some young adults who are deaf-blind. So you can imagine going from being around a lot of deaf people and having that great exposure to deaf culture and the deaf community, and then having the great benefit of working and socializing and communicating with a great variety of individuals who identify as deaf-blind every single day, obviously informs your perspective and really informs your practice. So from that is when I actually started doing some interpreting. I feel like I learned from the school of the deaf-blind community I did not go to an interpreter training program. I really learned from one deafblind person to another, and it was more about access. It's like, oh, you can't see what they're saying. Oh, they're saying this. And so a very sort of welcoming introduction into the idea of interpreting. And so then I went on from there and got my national certification, and then have spent the majority of my entire career on the interests of communication access, working a lot as an interpreter, as a support service provider, an SSP, acting as a guide, and then doing lots of other things. And so I just want to put that disclaimer out there that everything that I've shared, during the next hour, 2 hours, is really quite fortunate to be exposed and to learn from individuals themselves who are deafblind. Another disclaimer that if you want very specific training on very particular techniques and methods, one that we'll talk about or mention is protactile. Protactile is just signed PT, or haptics, which is signed haptics, or sometimes haptics here on the chest. I would very, very much encourage you to learn directly from deafblind leaders who are hosting those trainings. That really is the absolute best way to learn. But in this conversation this afternoon, obviously we can't talk about one thing without mentioning the other, and so they all kind of relate. All right, so that just sort of sets the stage. I started working with adults and have kind of gradually worked my way kind of on the younger side. So now, as the director of the grant, working with children all the way up through young adulthood, and having the great benefit of seeing the techniques that deafblind adults themselves have pioneered and utilized, and particularly the deafblind individuals who can have a voice for themselves and say, this works, this doesn't work. Taking those strategies and applying them to younger learners is really the push, is really the idea behind this conversation. And then to help inform all of your practice. So before we move ahead, I would just then ask what your role is, just so I can have an idea. If you can type in the chat box, if you are an interpreter, particularly an educational interpreter, community interpreter, and any other role you might have or you play on a daily basis, that would help me get an idea of who's in the room. I'm going to go ahead and open my chat box over here. Great, some messages are coming in. Educational interpreter, regional school principal, welcome. Great. SSP, community interpreter, interpreter educator, awesome. Great, a good mix. Past SSP, now community interpreter, educational, and also video relay, teacher for the deaf, great. Awesome, okay, that gives me an idea of where we are together. An interpreting student, yes, welcome, welcome. Because we all know it's got to start from the very beginning in interpreting programs. If that's where you're headed, that's where we need to start. Great, and a special needs teacher working with deafblind students. Awesome. Okay, great, thank you. And at any point too, Jen asked me if we wanted to hold questions to the end, and I would say no. I would say don't go crazy in the chat box because it can get visually distracting to other participants. But if you do have a question pertinent to the content, please do ask a question, and I'll probably try to poll you a little bit as we go. All right, so we want to talk a little bit about the role of an interpreter, particularly educational interpreters, or being in the educational setting. And then I thought we would spend a good majority of the time talking about, well, what is vision loss in its relation to interpreting? It would be very smart to take another class that is really in depth all about vision, but that would take us a lot more time. And I would encourage you to look up those other training opportunities. One being Perkins School for the Blind, which hosts many, many, many online trainings that you can take for credit, for not credit, just to expand your knowledge as it relates to your practice. But today, just kind of putting it in the frame of access to language, to what would be traditionally visual language for younger learners. So that's kind of the angle for this conversation today. All right, so before we begin, what do we need to know? Now, a lot of you are interpreters, so a lot of you have this knowledge, but I think sometimes it's hard for us to have the actual words to turn around and explain to others, right? And as it relates to deaf-blind related content, that's kind of again, the direction of the conversation. So one thing we need to point out is that there is no standard curriculum for training interpreters. Number one, that's probably the biggest challenge across all the interpreter education programs in the country. There are some basic expectations and requirements, but they can be designed a little bit differently. What's really important about that fact is that the content related to deaf-blind information is also extremely varied. It can be everything from completely absent to a full course on deaf-blind interpreting that's a semester long, and sort of everything in between. Many people exit an interpreting program and say, oh, we met one deaf-blind person one night over the course of 2 years. And it's like, well, obviously that gives you one experience, and that doesn't really inform your practice and an understanding of how you would then accommodate your service provision for a whole range of individuals. And so what we know best, though, is to be able to provide content and information just sprinkled throughout the entire program so that interpreters can leave a program with a very extensive range of knowledge and extensive exposure to the breadth of the community and what those needs may be. We also know that there are different entry requirements for interpreting programs, which can be tricky. Some you come in where you have no language requirements whatsoever, and you are learning sign language as you learn to interpret, and then others come in with a very higher level of skills before you can enter the program. So that also is a big range. One thing that's very important also is that we know that when interpreters leave a program, they're not necessarily prepared to work with sort of non-traditional deaf people, meaning individuals who maybe American Sign Language could be their third or fourth language. Perhaps these are individuals who have emigrated to the United States and their first language is Costa Rican Sign, but they also know written Spanish, and then they learn English, and so interpreters aren't necessarily prepared to modify their output for individuals with varying expressions of language. And that also applies very significantly for people who have what we would call sort of atypical vision. All right? But what is expected of an interpreter is the opposite, is that we are expected to accommodate the language needs of each individual. So if that's the end goal, we do really need to work backwards from that and be able to build all those foundational pieces so that we are empowered with the right knowledge, with the full breadth of the skill set that is needed to meet the needs of a very extreme range of individuals. In particular, for those of you who are educational interpreters, your experience will be different than those necessarily out in the community. If you're going out to doing community interpreting, most likely, not always, but most likely, you're going to be interpreting for individuals who have their own self-determined behaviors, who make independent choices, make independent decisions. You are there just to facilitate communication. However, if you're in the educational environment, that may be a very different experience. These may be younger learners who have emerging language skills, where you may be the actual language model that they're looking up to. That's a very different role than being out in the community. And then if you add a layer of atypical vision on top of that, additional factors that we have to consider. I don't want to spend too much time on this because since a lot of you are interpreters, or if you're in the educational environment, you probably work with educational interpreters. But we do want to point out that, you know, the role of an interpreter, a traditional role of an interpreter, is just to facilitate communication, right? From spoken language to a signed version of the language, whether it's into another language, American Sign Language, or within the spectrum of English. An interpreter is not responsible for the learning of the child. And what is tricky is then, again, if we put a deaf-blind child in that position instead of a deaf-sighted child, and we sign sighted like this, But if you change the student who's receiving the message, does that change the role of the interpreter? And that's where you may have to have a conversation about, well, what are the learning needs of the child? Does the child need a communication facilitator in the role of an interpreter, or do they need someone to help facilitate learning and communication access? If that's the case, then that would be a different role. And that's the role of an intervener. And we sign it like this. And so again, that would be a whole other conversation, another presentation, but it is important to understand that that role may be a little different. We're starting to use a lot more deaf interpreters in the educational environment, which is quite wonderful. If you can think about how native signers, individuals whose first language is sign language, what a wonderful role model of language that would be for that young deaf person or deaf-blind person in the classroom. I know here, I'm in New York City, and I know here in the city, I think there's about 10 deaf interpreters who are working in the educational setting, which is really great. And it's obviously every educational environment is different and the demands are different. And so that's something that has to be assessed, but to highly encourage that. I just want to make sure I'm not overlooking. Just checking the comments. Yes, understanding the learning needs of the individual. And it's not only the learning needs, but also the communication modalities and knowing those, right? And then understanding, what is the role of the interpreter? Because it is important to understand who's paying this person. Depending on where you're from, and it may even be different in Maryland across the state. Maybe it's different district by district. I know here in New York, it's extremely varied depending on your location. I live here in Manhattan. I'm in New York City. And so obviously the 5 boroughs of New York it's one, imagine this, New York City that has 1 million kids in school is one school district. You take that out of all the other 750 school districts that we have in New York State. So then you can imagine that the processes in which people are hired and paid can look very different. And so it is important to understand how that interpreter came to be, because it will impact their role in the classroom, if they're a staff person or if they are just hired from outside. And obviously, the interpreter is also there to help facilitate interactions with their peers. What I think is very important to understand also, particularly if you are I see there's a principal in our session. If you are the hiring person, you're the teacher in the classroom, I think it's important to understand what the local licensure or certification requirements are. So you would know best about what that is for your state. I am ashamed to say that New York State is one of the remaining 5 in the United States that does not have any statewide licensure or certification requirements. That's a frightening statement, because that means there is no one way to measure even a minimal skill set that is applicable for the classroom. So that's challenging. And so some states, and you can tell me if you all are a very strong EIPA state, if you are doing the educational interpreter performance assessments, that is definitely one step in the right direction, right? That allows a sort of level of minimum requirements. So, I think we're in the same boat then. So maybe it's New York, Maryland, and DC, and 2 more. So if that's the case, we are all in the same boat, and that's quite concerning, because how then can we assume that there is a baseline of knowledge, a baseline of skills, a baseline of professionalism and understanding your role? So that's challenging. And so what I would encourage you, if you are the interpreter, to ask questions, if you are the administrator, to ask even more. All right, so what we know is that we provide services. An interpreter provides services across a very broad spectrum, right? So it's not just about language as a spectrum, it's also about different entry points or points of access to language for individuals. So it's almost as if we have, you know, two layers of across a spectrum. So one way we can look about it is here, right? We have a whole range of language options. Make sure the chat box. Okay. And so we very often say, oh, I need to hire an ASL interpreter. I need an American Sign Language interpreter. And then you say, oh, I can do that. I can do that job. I have those skills. I show up on the job and the person in front of me does not sign what would be traditionally called American Sign Language. They more are an English-like signer. You know, many signers who say I use ASL actually are themselves kind of along a range. And is that important? Well, it depends on where you are and how and what level of skill set you bring to the table to that job, right? But then if you bring it to the educational environment, even more so, what is the language philosophy of the school? What's the language philosophy of the classroom? Are you interpreting in a classroom that has one or two deaf students within a hearing classroom? So are you there to provide sign language support, but it's more of an oral program? Or are you providing full language interpretation? So lots of variations along a theme that need to be clarified. And what we know about kids is that they really truly are multimodal learners, right? So even deaf kids who have no vision issues, if they are in a mainstream environment, they are exposed to a lot of language in a variety of ways. They're around hearing people. They're around auditory information. They most likely are wearing hearing aids or cochlear implants and getting auditory information, and also probably receiving services from a teacher for the deaf, an itinerant who comes in to make sure that their equipment's working and that they have access. And so that student, while they may still be listening, they may still be getting auditory information, it may not allow them access to language. And so that's where you may come into play. So very often, as an interpreter, you may be the language access, even though the student is hearing fairly well, right? So we have to just think about kids are along a very broad continuum of language and language access points. I also just want to point out that we're not having other cameras on. So if other people are joining in, we're not having the other cameras on just to lessen the visual distraction, and because the session is being recorded for other people or for later. Now, there's another way we can think about providing access along a spectrum. Everything from individuals who have typical vision, right? And I like to say typical as opposed to normal vision, because even within kind of like a normal range, we can have a little variation in our vision and we would still be considered sighted people. Like I consider I'm a sighted person, although just recently I've discovered I need a little more access, right? That comes with age. And because the lens on our eye begins to harden and it doesn't allow our eye to focus the way that it used to. So I would fall into the range of having typical vision. And I have visual access to information very close to me at a distance, but maybe I need a slight modification to access that more clearly. Well, that's many, many, many people. So we want to think about that in terms of sign language users. If you are the interpreter or the person providing language access, that someone could be sighted, right? They use visual language. Maybe they use their vision very, very functionally, but with accommodations. Maybe someone needs, obviously, glasses 24/7. Maybe they use a magnifying lens. Maybe they're using different devices to help them see better. But then also there would be modifications in our own production, right? And we'll talk a little bit about that later. And then everything all the way along that spectrum, from sighted visual signers to accommodations to people who use tactile sign language, whether that's one-handed or two-handed tactile sign language. And then also, which was mentioned before, additional touch techniques such as protactile or haptics. And there's a lot of content around that, a lot of debate about what approach, and again, that's not what this workshop is about, but we can speak a little bit about that. And then, are there other means of access? And the answer to that for individuals who are deafblind is going to be yes, because again, students or young learners who are deafblind are by definition multimodal in their access. So meaning someone may, depending on the location, use a communication device in one environment and not need it in another. Someone may need modifications to language in one environment and be completely sighted or visual in a different environment based on a lot of the content demands, based on the lighting opportunities that are available, etc. It could be based on how the individual's medication in their body is impacting their ability to receive visual information at that time. There's a lot of compounding factors. Think about a student who may have some additional medical complications, and that is actually the cause of their hearing and vision issue. Well, if they have other medical challenges happening, that obviously can impact their ability to hear and to see on any given day. So thinking about being in the educational environment, those are some of the things that we actually have to consider. Before I move on, I'm going to ask any questions. Feel free to go ahead and put those in the chat box at this point. If any of these terms don't make sense, you can say, what in the world are you talking about? Great. So as an educational interpreter, then you would want to know what the law says about interpreters. And so I'm going to just ask this question. I'm actually going to ask you to go ahead and type that in the chat box. What does the Individuals with Disabilities Education Act say about interpreters? Does anybody have that knowledge that they want to share with the group? And in the meantime, I'm going to turn down my air conditioner. Maybe it's a trick question and no one's ready. So, and it's important to understand what do we have backing us in the different environments that we are in. When we find ourselves in certain places, what's my safety measure? Who has my back? And what are the parameters that I'm supposed to function in? Great, good, good, good. So someone hit it on the head. We are considered related service providers, which actually means we are the equivalent of a physical therapist, a speech pathologist, an itinerant teacher for the deaf, or an itinerant teacher for the blind. We fall into the same category. And that is really critical information, because what that means then is that you actually do have a stake at the table. And I think that what is tricky for interpreters is that if you've come out of an interpreter education program, it's probably been drilled into you that your role has a very clear line, that you do not have an opinion, you are there to facilitate communication, and you do become a really amazing mediator of cultures and language and all sorts of things. But you've been taught that there's a very clear line. So that's a little different in the educational environment, because if you are a related service provider, that means you actually do have a part in the IEP team. And someone just typed that as I was saying that. You are considered an equal member of the IEP team. And I think sometimes that's new language or a new thought to people, because we're used to being just a facilitator of communication. So I think that's really important as it relates to students who are deafblind, because if you are that student's key language access person, then you will know you won't know what's best. I almost said that. You would know how the student best accesses information, how they're best seeing you, how are they best seeing their peers, how are they seeing the teacher, and also, are they hearing things? This is exactly the information that you could provide, because we are trained as interpreters to be observers. We are observers of people, of cultural tendencies, of interactions, in order to facilitate communication as equivalent of a message as possible. And so you actually should and do have the right to have input on the communication needs of the student that you're working with. So I just mentioned that because I think that a lot of people aren't familiar with that and know that they have that capacity in the educational environment, but is critical. And I, again, want to put the layer constantly over about students who are deafblind. So before we dive into the next session, I just want to say that and emphasize again your role, because particularly around working with students who are deafblind, is that it truly is the idea that the village raises the child. Because if you look at how many individuals, providers, related providers, may be part of that IEP team, it could be many, and it could be as many as 10 or 12 providers sitting around a table, all to support the needs of the student who is deafblind. And you would have just as equal and as critical a role as the other players at the table. And I would even venture to say even more weighted than some of the others, because you are the language key. So just to kind of throw that out there. All right, so before we move into the real sort of meaty vision part of the time together today, I want to see if there are any particular questions. I would ask you if you've heard of the role of an intervener before, if you have worked with an intervener. Oh, and let me also ask, if you've worked with a student who is deafblind, give me we like to use this thumbs up. And you know how you type that? You type it as B, lowercase b and lowercase d. Look, it looks like two thumbs up facing each other. This is what we learned by living in the Zoom rooms for months on end. So if you have worked with a student before who is deafblind, I want you to type a small b, small d. That means, yes, I have, thumbs up. Ooh, I have a couple yeses. This is exciting. Okay, so for those of you who have, why don't we share with everyone, did you know the student's etiology, the cause of their combined hearing and vision loss? And if you did, what was that? What was the cause of their combined hearing and vision loss? Because those may be some of the terms we end up talking about coming up next. And the thing about, too, being in the role of an interpreter in the school environment is oftentimes people aren't quite clear about your role. And so you may not have been provided access to the IEP even. You may not have had access to the student's records. And so you may not actually know what the etiology is. And sometimes there is just sort of an unknown, and that's a true thing. But then there are others that are very clear. Right, agreed. So a couple people said charge syndrome, right? So if you're in the educational environment, that could be a very strong possibility, working with a student with charge. And that in and of itself is also its own workshop. But charge, the letters in charge each stand for particular components that make up the whole of the individual. It is a genetic condition that can have a lot of medical complications, but can have individuals and do impact individuals across a very broad spectrum of experiences. Usher syndrome, of course. And trisomy 13. Definitely, there are many, many, many potential etiologies that could actually lead to, the combination of hearing and vision loss that we can discuss at length at another time. But there are some common ones that we can anticipate that very well could be in the classroom, that you would then be there as the interpreter. So it is helpful to become familiar with some of these terms, and in particular, some of the syndromes. If you have not been exposed and already you're saying, I don't know what in the world RP is or charge or these other things, I would very much encourage you to get in touch with Jen and Donna at the Deafblind Project for some of those quick resources that could truly just inform your practice in a way that at least you don't need to be an expert in all of these things, but I think just to have the language at the ready, because when you go to interpret something and then someone says something that you're not familiar with can be very challenging in sharing a clear message. And so the more knowledge we have, the more we fill up those files that are back here, right, and the recesses of our brain to rely on, will be very helpful for all the parties involved. Okay, great. All right, so why don't we move then into talking more about some of the vision pieces and how that can impact our production and some of those access points that we talked about. So before we move ahead, we're going to take a 1 minute, 2 minute stretch break, and I'm going to ask you to get, I presume most of you are at home. Maybe it's a broad assumption, but I think most of us are still having access to our houses. I'm going to ask you to get two supplies. I want you to get a piece of paper. I imagine that would be pretty easy, right? Somewhere in your environment. And also, if you're at home, I would like you to go into your kitchen or your cabinet and pull out a sandwich bag or some sort of plastic wrap. All right? So I'm going to give you, we're going to start back here literally in 2 minutes. I'm going to allow you to take that stretch break and get those supplies, and we're going to start again. I'll see you right back here. All right, are we ready? All right, trying to see if we're ready to go. Anna, you're good? Okay, great. Let me figure out what I'm doing here. Okay, great. All right, if we're ready, then you give me the thumbs up in the chat box. Tell me you're back. All right, good. And we have our supplies, right? All right. All right, cool, cool. All right, so then thinking in the lens, that's not a joke. Thinking in the lens though of an interpreter, then what is vision loss in relation to that? And that can be a very big unknown to interpreters. Before we move on, I just want to make sure people are seeing, because all of a sudden I'm not seeing the interpreter on the screen, my video. Jen, if you're there, I don't know if
I've
there's
still got, everything looks good on my end.
Okay, I just can't, for some reason I can't see the interpreter or my video anymore. Okay, as long as we're here, that's good. Okay. So what's important is, I think, to gain a little bit of that knowledge about vision loss as it relates to interpreting, because you will encounter this at some point in your career. I mean, because many people, it sounds like some of you have had experiences working with some students who have varying vision. But if I talk to community interpreters, very often people say, oh no, I've never worked with, deafblind person. Until you start having a conversation and realize, oh yeah, that person who, who asked me to move back a little bit when I was interpreting for them, or that person who asked me to move a lot closer. It's like, right, because those individuals had varying vision and they needed different points of vision access. Aha, hold on. When you share a screen, you lose access to the gallery. Let's see what's going on here. I would like to be able to see the interpreter just in case, or any other fancy advice, because I saw, I'm so confused about this. Here we go. Okay, maybe we'll try this again. All right. Anna, you're good. You can still see the PowerPoint? Okay. Okay, cool. All right, I'm just gonna forge ahead. Okay, so when you think in relation
Stop
to,
sharing your screen though. Now we don't see the PowerPoint.
oh my goodness. There are too many things. Okay, hold on a second.
There we go.
All right. One of these days, there's too many platforms, I think. So in relation to vision, so here's the tricky part. There are a lot of different terminology that is used when describing vision loss, and that can relate to a lot of confusion, particularly to the interpreter. When providers start throwing out a lot of terms, there may be a lot of variation in the meaning, but people are using the terms interchangeably, which can be very confusing. So to clarify, we sometimes hear things like near vision. Okay, well, that's one thing. Is it near in this way? Is that what it refers to? We hear a lot of the term low vision. And so you may see it signed. See, this is the problem. I can't see the interpreter now. It's very strange to me. But you may see it signed LV right in front. You may see someone sign LV on the cheek, low vision. You may see someone literally signed as in low vision. There's not a lot of regularity with the use of that, which can make it very confusing, particularly if someone is explaining something to you and they use that term. But what's important to understand is the term itself has a lot of variation in use. And what do I mean by that? Well, particularly in the educational environment, if you were to read a vision report on a student, it would actually be called a low vision report. Well, low vision ends up being this sort of umbrella catch-all phrase that means all sorts of degrees and different types of vision. So as the interpreter, if I hear low vision, I may get a very particular image in mind when in fact they mean something very different. And that's thanks to our friends in the field of optometry. So it's really important. The challenge would be then is I would say if you hear that term, or if someone says, oh, this student has low vision, or the consumer you're working with in the field has low vision, that should actually prompt you to ask many, many more questions. So when you say low vision, do you mean they don't see well at a distance. Does that mean they need me to sit closer to them? Does that mean they need me to sit further from them because maybe they have a different type of vision issue? And we'll talk about those. I also just want to state, I'm hearing a lot of background noise. I don't know if you can mute everyone, Jen, but I hear a bunch of people typing, which may be distracting to folks. I think it's still on. I can hear some folks. I don't know if you can mute everyone. You may hear other terms like, oh, the student has fluctuating vision. It's like, well, that's a confusing idea. It's like, what does that mean? That it fluctuates from the morning to the afternoon, or it fluctuates all throughout the day? And one type of vision condition you may have heard of is called CVI, cortical visual impairment, which is gaining a lot of knowledge about and a lot of research over the past, I'd say, about decade. And we're learning a lot more about this type of vision loss. You can actually refer to Jen right there in Maryland, who has great expertise in cortical visual impairment, to give you a better understanding of that. But actually, CVI is one of those examples of where a student's vision or visual access may actually be fluctuating constantly. And that, as you can imagine, is quite tricky then. How do we know how to provide accurate accommodations? And so lots of questions need to be asked. You may hear other terms like tunnel vision. That's probably a more common one that you've heard. A more fancy term, restricted peripheral visual fields, which basically means tunnel vision. And now here's a couple other terms that I think are very tricky to understand, particularly in the educational environment. You may hear the term like, oh, that student has functional vision. That's a very common term you may see in the educational environment. It's like, okay, well, if the student has functional vision, but in what way? Does it function to read print? Is their vision functional enough that they can see clearly to read print? Is it functional that they only are able to see when the lights are turned on or turned off? Is it functional in a well-lit environment? So again, prompting those questions of, well, what does functional actually mean? A lot of these terms need further explanation, in particular as it relates to language access. Then conversely, you may see the label, someone is functionally blind. It's like, okay, so we just use the same word function, but now in a different way. If a student then is functionally blind, meaning that maybe they do have a little bit of access to vision, but they're more functioning as sort of as a blind person, where they can't really utilize their vision to navigate their environment or see details, or they definitely can't read print. But again, I would ask further questions about these terms. You may see something like NLP, no light perception. So these are important terms to start to have floating around in the back of your head. Again, in particular, as it relates to the educational environment, because most likely, not always, but very likely, when you come to that classroom with that student, for the most part, that student probably came into the world with what they're presenting in front of you. They may have had a different experience where they were born sort of typical hearing sighted, and then had a traumatic experience, which impacted both their senses. Or perhaps there was a student who was deaf and then also had cancer and had chemotherapies that were very intensive that then fried the optic nerve. There are lots of variations that could impact the student who's sitting in front of you. But if we're looking at the kids who are in the school settings, a great majority of those students come into the world congenitally, meaning born with what they're presenting in front of you, while there are some others who have progressive conditions and would present themselves later in life. All right, any questions about those particular terms? I imagine you've seen many of these over the course of your time, and again, in particular when you have when you're in the educational environment. So let's get into some of the meaty terms then. So if you're talking about different types of vision, there are different ways that we measure vision, right? So in the one vision, meaning acuity loss, and we would sign it this way, right? Acuity loss, that's your acuities. We can talk about field losses, but if you didn't see both of these terms here now, I imagine you would jump to think, oh, it's these fields, but we also have central fields. So again, being very particular about the meaning in which we're using. And I already mentioned cortical visual impairment, CVI. So let's kind of dive into each of these. It's going to be really important to understand if you hear that a student or an individual you're working with is legally blind, because legal blindness can be very confusing, right? We do have particular numbers that vision can be measured against, whereas hearing cannot. We do not have a legal hearing definition, as you all know probably, but there are ways in which to measure what's considered legal blindness. And there are two ways to do that. You see them listed here. One is through the central visual acuities, and then the other one is through the peripheral fields. And let's talk about a little bit about what that is. Ooh, before I go ahead, maybe we'll do a little test here. So what do we know? Does anybody know what is the legal blindness definition? Knowing that there are these two ways to measure it, what do you know about those measurements? And it's just fine and dandy if you don't know, because it most likely has not been your experience. We'll see if anyone's going to type in here. Oh, see, we definitely have some educational folks in this room, right? So someone said a little bit with a question mark. So 20 over 200? Okay, so there are two ways in which to measure our vision. The one for legal blindness being, hold on to that for a second. Right, so 20 over 200, and we'll explain what that is. But what I also want to point out before I move to the next slide is that people who are legally blind or considered to have legal blindness still may have very functional vision. And that's where those words jump out again, that the individual has functional vision. And it's helpful for you as a provider, as the person who's providing communication access, to understand what that functional access actually is. So understanding the numbers of measurement can be helpful if you have a base knowledge about what those mean. And then what's the application of that in the environment, and then also in terms of a person's access to language. So here we go. So correct, we have some great educators in this room who know this well. So think about that. Every time you go to the eye doctor, you sit in the chair, and what they're doing is measuring your acuities. They are measuring your distance, your distant vision, but also they're looking at the clarity of details that you have access to. So in relation to 20 over 200, that is an important number, because as I'm sure you do know, 20/20 being normal vision, right? So we have to think about that bottom number as a measurement of distance. It truly is that. So for example, if I have 20/20 vision, what I can see 200 feet away and see it quite clearly is essentially this, what my person next to me, my friend who has 2200 vision, needs that same thing moved up close to about 20 feet away in order to access it. So that gives you an idea. So I can access details pretty far away. I'm looking out my window, out my apartment, you know, and I can see the entire shape of the building. I can count how many windows are there. And that's even probably, that's got to be 500 feet away from me. So I have the ability to see clearly at a distance. Now, if there's a person who walks in front of their window, oh, sure, I'll be able to maybe make out the shape of the person, but I don't have access to any of those details. But as that person got closer, surely I would. So that's important information. So then if I can see that at a distance, my friend next to me with 2200 vision needs that moved up significantly closer, but could then have just about as equal access to it visually as I do. So I think that's really important as a person providing access to language. to know in terms of seating and distance and other things we'll talk about for modifications, right? So if that's one measure of vision loss, what's the other? Does anybody else have an idea about the other numbers as it relates to the measurement of vision? Give folks a second to type. Maybe this is a tricky one and people haven't had as much exposure to it, which is entirely possible. All right, we'll hold off on that. We'll get to that one in a second. So if we stay within the idea of acuities, then we're looking at, as the bottom number increases, obviously the more significant the vision loss is. But someone who has 20 over 200 vision actually has very functional vision. They just need things moved up closer, probably needs the font larger, perhaps increasing the contrast and color on dark font, on light paper, things like that. All right. So here's a kind of a good example. If you take a look at this picture, right? When you first look at it, what did you want to do? I automatically want to kind of squint a little bit and see if I can make things out a little bit better, right? So you start to kind of want to accommodate. And once you relax into that, you start to see, oh yeah, right? You can see the shape of something and kind of make those details out. So this would be a person who has, again, here's this term, low vision, where their acuities have been impacted. But now look at that. Look at the difference in the clarity. Let's go back again, right? Things are a little blurred. It might take you a second or two to kind of work out those details. Maybe you've missed some of the particulars about that, but you still have very good, quote, functional vision. But as we release that layer, now you start to see the difference between the clarity and details. And that's what's important to understand about access to language production, a visual language that moves very fast with finger spelling that can fly by, often, most times out here in midair without a backdrop, no contrast. And so think about what are those details that could be lost for someone who has that sort of vision, right? So you see the difference. And at first, maybe you couldn't quite make it out that, oh, it's a pink bunny and that was the ear sticking out and there's a pacifier and the little hands are right here, right? All right. Now it's time for an activity. So I'm gonna ask you to go ahead and do you have your plastic bag with you? Give me your thumbs up in the chat box if you're ready with your items. All right, awesome. Okay, I think we're ready to roll. All right, so what I'm gonna do is I'm gonna put up the instructions of what you're going to do on the next slide. And now this is all, you know, good interpreter honor, that we're all gonna play by the rules and follow along, no cheating. And so what I'm gonna ask you to do is this, right? So take your bag, I want you to fold it in half, and you're going to place it over your eyes, right? So you have just acquired your own new vision loss, and you will see how your acuities have been affected. So keep that bag there, and now I want you to read the instructions on the next slide. Here we go. Just keep reading. Okay, come back to me. So what did you find was tricky about that? Go ahead and type in the chat box. What was new or different about that with your newly acquired vision? Couldn't see the text. That's an easy one, right? Couldn't make anything out at all. Size was a factor. So think about simple modifications to the environment, right? That in the beginning, probably with the first font, easy as pie, very easy to read. It wasn't very challenging. But as the font changed, and then it changed direction or location on the page, became tricky, right? So I found myself squinting, right? You probably found yourself leaning in, looking for details. Only saw shadows, right? So couldn't read the small print at all. Harder to focus, right? So these are all things that if, in fact, a student could share with us, is probably what they would be saying. And so this is why it's also very critical as the interpreter, if I'm working with a student who has different degrees of vision loss, that I have conversations with the TVI, so the teacher for the visually impaired, who comes in, presumably if they have a vision issue, then they're receiving vision services. Very critical for me to have that conversation with the provider to get those particular pieces of information, because then I want to know, if the student is not seeing a certain size font, then that means they're going to have difficulty understanding production, finger spelling production. They're probably going to be missing facial expression. Very critical pieces that provide full access to language. And so that then in turn can help us consider how we then modify our language and modify our access. All right. All right, so that's a very, very brief intro. So now we're going to do a more, that was a static activity, right? Now let's do a more live sort of activity, right? So I'm going to go ahead and share my screen again and see if I figure this out. You're going to have your bag still, and make sure, again, once we start the activity, that you stay in your role for the best of our learning across the two-dimensional screen. All right, here we go. So I'm going to start something, and with your newly acquired vision, I want you to watch what's on the screen. Okay, I'm going to play it, maybe for only about a minute. I want you to observe that, and then we'll come back and reflect on it. Okay, here we go. Get your new eyes on. All right, now we're back on screen. Okay, now, before we have a conversation, I want you to take your baggie and fold it in threes. and I want you to finish watching the story, okay? So you're gonna fold it down one more time, and now I'm gonna get started. Okay, so now let's come back together. You're probably rubbing your eyes. So let me ask you a few questions. So what happened and what was challenging? What did you notice? What did you notice initially? First, tell me about the story. What was happening there? Horrible. Perfect, good response. Right. What else? Why was it horrible? Very much in need of contrast. It would have been helpful if there was entire black background. Missing the facial expression, facial grammar. Movements were easier to track, but it was difficult to make out the hand shapes. Related to the race part, bigger was better. So in her production, her movements were helpful. The whole screen just looked white. I focused more on body movement than facial expression. So let's think about this in the context of being in the classroom and you are interpreting the story, right? So the hearing teacher is reading the story, and what was the story? Surely we could probably recognize the story because we've had both visual exposure to this story before. If you're hearing, you've heard the story before, right? And that's that background information that allows you to rely on to help express your interpretation more clearly. So number one, that's important for what you bring to the table. But so let's say this is the first telling of this story to the student that you're interpreting for. So you may have to do a lot of setup work, right? Because there are some main characters in this story, right? It's the story of the tortoise and the hare. And so not only is it a story about two animals, that's nice, but there's a meaning behind it, right? And there's character, and there's motivation, and there's all these pieces of the story that can seem short and sweet, but in the end, we are hoping that the student can surmise, this meaning behind that. So with this new vision, right? Particularly, so the first time in half probably posed enough challenges, right? You start to lose clarity. You start to lose access to very important facial expression. She did great when we were saying like body movement, so her role shifting was pretty clear. But let's say the student missed that very important first piece of who was who, right? If the student missed, did you clearly set up, oh, this is the tortoise, right? He's going to be over here, and this is the hare, he's over here. Are you using clear enough indicators that would allow the student to follow the story? So if you were a person, right, with this sort of vision, you can start to imagine how those additional components or sort of strategies utilized by the interpreter, such as a pointing technique, making sure to reflect on the sign name again of the character, even if the story doesn't say it, right? So I think we're trained pretty well to do some of those things, but what we're also trained to do is simple shifts in role shifting to indicate this person versus that person. And those slight little movements, those changes can be absolutely lost on someone with atypical vision. I recently had the great fortune to interpret of course it was in Zoom, a meeting that had a variety of individuals who were accessing this meeting. There were hearing sighted people, there were blind hearing people, there were sighted deaf people, and then there were deaf-blind people with varying degrees of vision. So you're literally talking about providing access to almost, not the entire extreme range, but a very, very broad range of individuals. And so this, as you can imagine, was a meeting that required a good amount of prep to not only prep with the interpreters in advance, but also to communicate clearly with the facilitator of the event, because if they are following hearing culture, most likely they're going to be leaving many, many people behind, right? So you have to communicate with the host, and then very critically, and really, which is first and foremost, to be able to communicate with the deaf people and the deaf-blind people. Deaf people, they're used to accommodating for themselves. If visual language is available and or captioning, then that individual most likely has access. However, if you're talking about deaf-blind people or deaf people who have limited vision, then the rules change, and they very much should change. And a big part of our conversation in advance was, what are the best turn-taking skills that you like to see from interpreters? What helps make the flow go more seamless? When people talk over each other, which hearing people do all the time, how do we facilitate it? How do we manage those dynamics when there are multiple means of communication happening at the same time? And a big part of that was about, just now, the example of the tortoise and the hare. Who is talking? This general indicator no longer works for someone who has limited vision. The individuals wanted to know this, let's say this is Sally, and we've already set that up that this is Sally and Leslie, to use those very clear indicators. And so those are some strategies that you can absolutely employ in your interpreting work. And this is not rocket science. This is not exactly, well, you may be interpreting a rocket science class, and that's a whole different story. Because, you know, deaf-blind people do take physics, and deaf-blind people do become engineers. And those are the ones who we want to challenge us and challenge our work. So now we're not even talking about visual or tactile access. It's like, what in the world does the interpreter know about calculus, right? And so for those of you who are in the educational environment, we got to be prepared on a whole variety of levels. So what else can you say about that experience? What comes to mind then, thinking about how you provide services? Like, what would have made your life easier during that? We talked about contrast, right? We talked about movements, clear movements of the body. Some particular strategies, right? Using pointing is good, but making very, very sure that we're clear on who is set up in the environment and where they are. Using sign names repeatedly, probably much more than you would in your general sort of sighted interpreting work, right? So those are some pretty clear things. To add a layer of protactile on top of that, or touch techniques, is thinking ways in which we can help bring in and use the sense of touch to help supplement someone who is still using their vision. So one thing I want to emphasize is that when you think about tactile and you think about sometimes protactile, you think it is truly only for those folks who don't have access to vision, when in fact that's not the case. Going back to constantly remembering that deaf-blind individuals are extreme multimodal communicators. And so even though they may really be using their vision, if in fact that's limited in some way, we'll can greatly benefit from additional touch techniques. And so I would challenge you to think about what are ways in which that story could be embellished to help create a better image about what the story is. And for those of you who are in the educational environment, if you're a teacher in particular, I have a feeling maybe you would think like, oh, well, maybe I can actually have the objects there, right? Maybe I can, for my story, if I'm doing good storytelling, I have a stuffed animal turtle and I have a stuffed animal hare, and I'm going to be saying, there it is, right? Particularly for younger learners. And how can we have access to tangibles that can help emphasize that story? Great. So a good example, someone just said a bumpy ball versus a small ball. One could be the turtle and one could be the hare, right? So if you're in the educational environment, use those tangibles as much as you can. And right, and an actual object doesn't have to be the object. It could be something that represents an item. So yeah, thank you for saying that. That's great. All right, so we need to start thinking about those sort of things, because it really does make a big difference in terms of ability to receive an incoming message. And so someone said here, now I didn't ask you so much about the emotional aspect, but what were you feeling during that process? So it's one thing to think about the, cognitive part and the academic part, but what were you feeling as the student in that experience watching that story? Frustration, fatigue, and didn't want to watch. What else? Yeah, feeling frustrated or lost. Exactly. So think about the students that you work with, or even consumers out in the field too. It can also be community interpreting. If someone is really truly experiencing vision similar to what you just went through, you can imagine then how much that person may want to take a visual break away from you, away from all this visual clutter that's in the environment, because it's exhausting. And then someone pointed out, feeling like I was missing something. Individuals who have the capacity to share with us often say they're constantly worried about missing information. And then next thing they know, there's something, now I have to respond to something, but I feel like I missed some of the information leading up to this. And so then maybe I shouldn't answer the question, or I can't answer the question. So a lot of pieces come in on top of that, right? Which also can lead to feelings of low self-esteem and all those other things that come with it. So if we can trail it back to access and knowing the right access points and trying to be as accommodating as possible from our end, could help reduce that fatigue and the physical strain, because it is tiring. And one thing that we have to remember, oh, good timing. And one thing we have to remember is that the eye, where it's different than the ear, the eye itself is a muscle. So the eye itself does work. It has to work differently. And so the eye itself can be fatigued in a way that it doesn't take a lot of physical energy for me to listen, right? So I'm sure we're all experiencing this now, because we are living and breathing in a two-dimensional world right now. We're constantly in Zoom and all these different online platforms, working from home, that, halfway through the day, it's like, oh my goodness, you just want to take your eyes out, wash them out, put them back in, because it's a lot of strain. So if you think about adding a vision issue on top of that, obviously is challenging, right? Okay, so thank you for playing along with that. Now we're going to go on to the next piece. So let me try see if I make this work again. All right, so we answered a bunch of those questions. Great. So now thinking about the different type of vision that we can measure. Oh, shoot, I put the numbers up too quickly to be able to elicit that from you guys. So think about all this vision that we have out here. So now we're talking about the opposite area of measurement, right? Before we were talking about our central vision and our acuities. Now we're talking about the vision that's above our head, below us, and to the sides. So those are our peripheral fields of vision. So we have approximately 180 degrees, we sign at 180 degrees of vision, right? And that means it's all of this that we're using. I've said before, accidentally, we have 360 degrees of vision, which is not true because we're not owls. We can't look behind our heads. But without even thinking about it, if you have typical vision, you should be able to look straight ahead and notice what's in your periphery, right? I can sit here, and if I stare directly into the camera on the computer, I can see ahead of me that there's my dining table, there's a lamp on top of it with a curved, what's it called? Shade, lampshade. I can kind of see the makeout of the plant that's on the table, and I can definitely see the big windows out there and the broad shape of the building across the way, right? So you can do that. But now what also is important to remember about that is that I also have visual memory. My brain is able to fill in those pieces because I know what my environment looks like, right? It's very different than going into a brand new space that you've never been to before, that if you only had a quick sweep of the room, if you closed your eyes, you might be able to pick out certain things and remember them, but because you don't have a lot of exposure, you wouldn't be able to provide the information in detail. So the reason that it's important to talk about is because visual memory is critical. So if you've had exposure to vision before, that's helpful in terms of color and all these other sort of things. But then also, as it relates to fields of vision, that while I look straight ahead and I might be able to make out these shapes of things, I don't necessarily have details about them. Our peripheral fields are not designed to give us details. That's our central vision. So, but what's important about that is the second I turn my head a little bit, now I see more things over here in my periphery that I didn't notice before, and I can turn back. And all that information is important to me because subconsciously it's being filled in to create the bigger picture of what I'm seeing for vision. So why is that important? So that peripheral fields of information is really it's my warning system in many ways. It's my information system about what's around me. If my vision is typical, I should be able just to walk around or walk in my environment without having to look down to see where my feet are going or to look down to see what's in front of me. Except when something is different. If something is different about your body, if something has changed about your body. Back at the winter break in February, I had a ski accident and I tore my ACL. I'm sure there are many of you out there who've had that experience. So the ligament in the knee went, right? And next thing you know, now that I have an injury, I had to use and move my body in a different way. And you wouldn't think that your leg relates to your vision, but when there's a sort of disconnect and you have to move differently, you actually find yourself accommodating in different ways, not only walking differently, but literally thinking about where your feet are in place. That same sort of concept can be applied to then if someone experiences some sort of change in their vision. And so we think about individuals, a couple people said they've worked with people with Usher syndrome. So Usher syndrome would be the example, one of the best examples for this type of vision loss, where the peripheral fields of vision are impacted, right? And we very often, see, this is tricky for me because, again, I cannot see the interpreter. I'll come back for just a second. We very often sign, people with Usher, their vision goes like this, right? It's a kind of common way for people to sign that. And we do have to be mindful of that because if you're saying, especially, let's say you're interpreting a medical exam, right? And the eye doctor says, your vision, you're going to lose your vision now. And so that was a choice, right? So you say, you're going to lose. So this was a sign, right? That's it. So that's a sign that's used very often. That doesn't, and this is nothing with our interpreter, but if in that environment, that does not provide information to the individual. Now, another person may say, oh, your vision. Now, if you just saw that, and I saw that, that's frightening to me. Wait a minute. You're saying my vision is going to move that rapidly and it's going from way out here to absolutely nothing? That falls on us as the interpreter. Now, before you would sign any of those things, I would very much challenge you to consider gathering the right information in advance. Say, doctor, when you say the person will be losing their vision, can you describe what that will look like? When you say peripheral field loss, and you use that big word, right? You say peripheral, and as the interpreter, you don't know what that doctor means, so you just spell peripheral, and the person says, what are you talking about, right? Because those are some words that are not necessarily in our daily vernacular. So if that's the case, we need to think about what does that mean? So this is a good conversation to have, because what happens, in fact, with RP, which is signed RP, which is, here we go, ready? Retinitis pigmentosa, RP. So RP is the eye disease in the back of the retina, right? So it would go this way, and I would go this way because the retina is in the back of the eye, right? So if this is the front, we're looking in. Now we're talking about all of this red pigmentation in the back of the eye, which is the rods and the cones. So as those start to die off, right, they start to dissipate. What happens is the vision does not go like this. It goes like this: blind spot, blind spot, blind spot. Okay, those are called scotomas, right? So as those vision dots or absence of vision start to grow, they start to actually impact the mid-periphery of vision. So that means kind of like right out here. So if you are looking straight ahead and you think kind of like, take your hands and they go right off of your shoulders, kind of in an outward way on yourself, that's the vision that actually could be absent first. So that's interesting, right? So that means if you look straight ahead, your central vision, spot on. Your extreme peripheral vision can also be spot on, but it's actually right here in the mid-periphery. So, and then as those blind spots start to grow, it actually goes outward very often this way and starts to come inward. So in essence, in the way a person in more advanced progression, it looks a little bit like this, because an individual ends up with what we would call tunnel vision. It just doesn't go like this. It's just the only way that we've ended up signing that. So I would just caution you in the way in which information is shared, that this is a frightening sign as the receiver, as opposed to, well, your vision, maybe changing, because we do not know the progression of that individual's vision loss. There can be one person with Usher who hangs on to their peripheral fields for many, many, many years, and then to their 50s, and then they're starting to see an experience, all the way to individuals who experience dramatic changes in their 20s. So we're talking about a very broad range of experience. So I just want to challenge you to think about the way you sign certain things and how that might look to the receiver, because it carries weight and it has meaning. All right, so let's move on to our next activity as it relates to this conversation. So now you need this, right? All right, so you're going to create your own peripheral field of vision. I'm going to ask you to roll up. You're going to roll up your piece of paper. I'd say with about an inch wide, all right? Maybe a little less, maybe a little bit less, maybe about, yeah. All right? Now, if we're ready, I'm going to ask you to give me your thumbs up in the chat box. This is some fancy stuff right here. These tools, right? We're high tech on this deafblind project. Great. Okay, so now, again, it's going to be interpreter's honor, right? So no cheating. So I'm going to ask you to put your new eye on. You can either just close the other eye or cover it, right? And when I change the screen, you're going to follow the instructions with your new vision. And I'm going to allow a little time for that, okay? So get your new eye on in all fairness and trueness. And now I'm going to show you the instructions. All right, let's just give it a minute. People coming back. All right, I think a good majority of people are back. All right, so go ahead. Some people have said, so what happened? What was challenging? What did you do differently than you normally would be doing? So I'll read a couple of the comments. A couple people said, eek, that was very hard. Depth perception was way off. Took much longer than expected. I had to be more careful in my movements. Someone said I nearly broke a glass. Eek. I tripped over my dog. 13 stairs in a home built in 1890. Whoa. Can't type. So let's think about that, right? So now, granted, you just experienced a very extreme degree of vision loss in a very short period of time. So let's be real, that's tricky. So what is different about that? So let's say, now, it's not entirely accurate for us to be able to say, close one eye, look through this one, because we have binocular vision, right? So we use information coming in from both of our eyes. It comes in and then gets interpreted in the brain that allows us to understand our whole visual environment. So let's say that means you would literally have to not have access to any vision whatsoever in the other eye, but this is kind of the best way we can simulate it. But the idea being that if you limited your vision to this, right? Now, think about how you have to move in your environment. I would aim to guess that every single one of you had to go like this. You had to now look down to figure out what's in your environment. Like, is there a dog in the environment? Where are the stairs in my home? All of a sudden, these things become very important when before you don't even think about that. And that is the benefit of being sighted. That is the benefit. And there are a lot of new terms that are coming into the field and into the community. You may hear something called vidism, right? VIDISIM. So having the benefit of being sighted, using your vision is taken for granted in comparison to the individuals who may have limited vision. So constantly being mindful about our place in the world and our experiences that are brought to the table, because very often they are quite different than those of the individuals that we're working with. What do I take for granted in my visual environment? Just thinking about that. So the idea of conducting a simple task, that was a simple task of getting a snack or getting a drink, became not so simple. It became something that took more time. It took more time for you to navigate through your own familiar environment. You know where your cabinets are, you know where the glasses are, you know where you can reach in for the milk in your fridge. And so all of a sudden those things become very different. So we need to think about that as it relates to the individuals we work with. It also helps you probably understand, in terms of deaf culture, it's appropriate. We wave at people to get people's attention, right? Totally appropriate. That's part of the culture. But with someone who has limited fields, if you had a limited field like this, right? And you're very much concentrating on the thing you're looking at, and someone, put your vision back on for this particular example. So if you roll up your paper again, think about this. And if someone waved at you for your attention, go ahead and wave your own hand. When that comes right in front of you, it's very distracting, because now there is some sort of visual obstruction that now has to be investigated, but now it's gone. So with very limited fields of vision, that can be very disruptive and doesn't allow an individual to feel their own sense of empowerment in their environment. So that's why even individuals who are still very visual, even with this limited field of vision, I am still a sighted person, because I can still see the interpreter. I can read all the comments. I just may have to accommodate myself in a little bit of a different way, but I still have access. It's until things move in my environment is when you start to see that things can be more challenging, right? So even though I'm still a visual person, you might imagine then how some sort of touch technique would be not just easier, but more comforting, more respectful, less distracting, and just easier for us to make a connection with each other, right? So those are some of those little tidbits that, again, until you have these experiences yourself, or until you're around a lot of deaf-blind people and observe their interactions and what works and doesn't work in their own interactions, is when you can start to incorporate those into your work. So if you can keep some of these little tidbits, I think that you could consider that. All right, I'm taking a look at our time. I think we're doing quite well. Excellent. Okay, so I'm gonna challenge us to one other little activity. You need your eye again. This time you're gonna make it smaller. I'm not gonna make you move around, so don't worry. You're not gonna trip over the dog this time. So I want you to have a more significantly reduced field. So you should have maybe only about, I don't know, is that a half an inch maybe, right? Okay, so put your eye on, and I'm going to show you a little clip. And so I want you to take a look, and then we're gonna reflect on it, all right? Don't cheat. All right, let's come back. All right, so how did that go? What happened? What was the story? And of all things, who the heck was Dave? Right? So someone said, I didn't even know there was an interpreter or a deaf person tell the story until it was almost finished. Wow, could not see everything. I didn't know there was someone signing or that there were words on the screen. It was awful. I missed huge chunks. I think it's funny, you're all assuming it's an interpreter. It's actually a deaf person telling a story. So it could be the teacher in the classroom, not interpreter. I had to move, right. So what sort of accommodations did you have to make? So let's see how many challenges we had, right? So number one, the benefit that you had was that you weren't moving around. So you actually had more of a static environment. So within good accommodations, right, to best of your ability. So someone said I had to sit back very far to be able to get a better idea. So very true. So think about that. So a natural accommodation then for someone with these limited fields of vision is going to be more distance, right? To be able to be tricky because, let me see if we're frozen again. Here we go. Checking this little internet over here. Good, Cheryl?
We were great until you asked that. Uh-oh, we got so close. There we go. We might be coming back.
I
See
think
movement.
it's,
I think
yeah,
we're good. Yay.
all right. It's like we're getting to the end and even the internet connection is tired. So I started to say, moving back further obviously is an accommodation that broadens the visual field. But you have to think about how possible is that in an environment, and then what are the other restraining components that may take place? Because then the further you sit back, there could be other visual interruptions. Maybe the person can't see the screen as well. So there are some things to think about. Now, the other pieces that are challenging, many of you said, I didn't even know there was a person on the screen signing. Because think about, your field is small and you're concentrated initially on the first picture. Aha, there's an animal. Oh, there's another animal. Wait, and then nothing seems to be moving. Then I need to look, I need to move and search the visual environment. So it could be very easy to not even see the person come on screen. So the reason we do these sort of activities is to get us kind of stimulated along those lines going, okay, there are multiple components that in this case, as a sighted person, I am taking for granted my very broad scope of access. So think about that as an interpreter then, how helpful that would be if there's a story to say, you know, what's going to be on the screen, that, oh, there's an animal there. Oh, they're signing there, to help direct the person visually with information. And this again is where touch access or different touch techniques like protactile can come great helpful, because a person with those limited fields of vision, think about this, if your fields are very small, right, and you're focused on the screen, I actually could be the interpreter behind you that uses touch techniques on your back. I could simply do something as easy as using my hand as sort of like a rudder, right, on a boat that goes, if I do it this way, the boat's going to go one way. So I could even do something like this on the individual's back. Look that way. Look that way, right? And these would be things that we would agree on in advance, that those movements mean certain things that allows the individual to connect, right? And to be directed without me having to interrupt and say, whether it's tactile or to come back in front, or how can we do things that allows for a more seamless production of language, more seamless access to information, and allows that more, encourages more self-determined behaviors. So you start to imagine that there may be ways to do this that empowers the individual in a way that they may not have otherwise known that they could be until we provide those things as options, right? Naturally, someone said, I started to get a headache from the eye strain. Sorry for that. You all experience a very rapid degree of vision loss very quickly. But I think what's also important is that, right, someone said, I had to get a bit of information. So what often people say who have different types of vision is that I'm only getting bits and pieces, and then they have to kind of figure out the puzzle and put it all together. And that's a lot of work. So how can we make that a little bit easier for people, right? And again, particularly for the younger learners, thinking about if we start these techniques early, that allows that individual to increase their own self-empowerment, self-determined behaviors, being comfortable reaching out then saying, actually, I didn't see that. Can you tell me what that was? If we don't, give those opportunities and build those skills early, that will be a delay in development, a delay in self-determination. So thank you for playing along. So hoping that, because those techniques or those little simulations, again, are not real, but they are as close as we can get in this obviously two-dimensional world, but also not being a person who has that life experience. How can we glean some perspective by doing some of these little things? And so hopefully that will bring some of that information more to the forefront of your minds in your work. All right, so we have just a few minutes left, and I want to cover just one or two more things, in particular as it relates to language and some sign choices and things like that. Okay, so we did this. Here we go. So we talked a lot about different terminology, particularly as it relates to vision and vision loss. Oh, that's one I wanted to say though. Oh, it comes up here. Okay. So there are different ways to sign things, different ways to say things, of course. And the way words are used is very important. And what's really important is that we listen to the perspective from within the communities of individuals that we serve. So obviously we have seen a lot written and spoken about by deaf people from the deaf community about what is acceptable, what's respectful, different ways that we say, we have shifted over time to say hearing loss as opposed to hearing impairment. How and vocabulary will evolve and grow over time, just like terms as it relates to combined hearing and vision loss. So you'll see deaf blind even written in a bunch of different ways. You may see it like this that's on the screen, where it's capital D hyphen capital B blind. You may see it written as one word together. You may see it, I didn't put all of them here, but you may see it all as all lowercase. And this is something that is still not consistent across environments. Most likely internationally, you'll see deaf blind oftentimes written as lowercase. But if you're talking about the experience of being deaf blind, not as a cultural person, you may see that as lowercase, one word. But the cultural identity that is being more embraced now by deafblind adults, you would see it as a combined word, no hyphen, because it truly is a comprehensive, holistic experience. It's not just being deaf, it's not just being blind, it is truly the experience of both senses together. And I already spoke to the interpreters in advance, and they are aware that we don't sign deaf blind this sign for blind would be kind of an old-fashioned sign and carries a heavier weight of meaning behind it. So the sign is deaf-blind, and it's produced here on the cheek. And then in your production as it goes, it almost has kind of evolved into its own sign. It's a little bit of a swoop movement, deaf-blind, and that is appropriate. So I would caution you in the use of kind of more of an old-fashioned sign. Low vision we spoke about, we don't need to get into that again. Here are two of my big ones, and I'll set it up before I say the terms, because we often see the production of signs because it's commonly used, but that doesn't mean it's accurate. So when someone says vision loss, it's not loss. I know I keep hopping on and signing and not signing. It's not vision loss, because vision loss in this respect shows the progression of something. That's the verb. And so when we talk about someone will have a loss, you could sign, that means there will be a change in something, right? You can also say, if you're describing progression of vision changing, it could also be this, it could be a down progression, it could be a this progression, it could be a this progression, all different ways. So again, I would challenge you, when someone says vision loss, that could be difficult to know exactly what that means. And so two things here. You may not exactly know what that means when they're describing it, but also it is an inaccurate use to use this sign, because that indicates a verb, as opposed to vision loss, and it's spelled L-O-S-S, because that's the noun. That would relate the same thing to hearing. So it's not a hearing and vision loss unless you're trying to say a progression of hearing and vision loss. And I also would challenge you in the idea of, it's not this, because that means, holy moly, that is also rapid change. So it's the same thing it would equate to, how quickly were you going? If it was really, really fast, as opposed to, right? So our movements have very clear meaning associated with them. So I would challenge you in thinking about that. And we talked a lot about progressive vision loss. So when you hear that, let's say you are interpreting the meeting with the teacher for the visually impaired, with the student and their family, or you are at the eye doctor with the family, and the doctor says, you will experience progressive vision loss. I truly don't have a clue about what that means unless I get more information about that. So again, just to point out, our sign choices really matter, because it can truly mean one thing or something very drastically different. Lastly, we don't really have time to get into all of this, but just to indicate, we know, going back to that kind of beginning where we talked about the broad spectrum of modes of communication, there are many, and there are, again, to emphasize how truly multimodal individuals who are deafblind truly are, where you can have someone who has both a hearing and vision loss, but they still speak for themselves, and maybe they're using assistive listening devices. They may also be someone who listens and watches sign language. They may be a full-on sign language user, tactile. All these particular things could be playing together. And then not to forget to mention other assistive devices, different equipment that may be used, Braille, all sorts of different portable technology, a CCTV, which enlarges font, you know, et cetera, et cetera. So there are many things many tools we may be using or maybe seeing that are in our environment during our interpreting process that a student may be using simultaneously. And so that's something to think about. And if you as the interpreter don't know what in the world that device does, that's also very critical. You need to have access to understanding the equipment, knowing how and when it might be used by the student, understanding when they may switch devices. Does the student know how to use it? You know, all those sort of questions are really critical. All right, and then lastly, we've covered a lot of these kind of just throughout our conversation, but some simple pieces that can help us in terms of the communication or interpreting process. Obviously, you experienced a couple different types of vision conditions yourself. Think about those things. What would have made it easier for you? You know, be mindful of the background. The contrast is so, so important. The visual clutter in the environment can truly make or break your communication experience. Think about how you lost those details. If you simply move your arm in when you're finger spelling and it's not floating out in the air, bringing it in not only accommodates for a small field of vision, but it allows for contrast behind your clothing too. The identifiers we talked a lot about, just general direction, pointing or body movement doesn't help necessarily identify who is speaking in the environment. Using sign names, we talked about that. And I would very, very strongly encourage you to do some more research, familiarize yourself with different types of touch techniques. Protactile, you'll hear a lot in the community about one method versus another. So educate yourselves, but also I want to emphasize again, many people who are still functional vision users also greatly benefit from touch techniques, okay? And you can imagine how that would increase a person's access just based on your own experiences just now, you know, very briefly. Right, so, oh my goodness, right on that note, I think we're right at 5 o'clock. I don't know if there's any last questions. Jen, I kind of ran us right up to the end. I don't know if Jen has other questions or an evaluation to put in. Yes. And someone asked the question, if we are doing virtual work, what kind of screen should I be using? Great question. The challenge is a lot of them are sold out right now. Some of the best ones are like almost like the green screen, the photography backgrounds that people use are very good because they're already designed to reflect light. You want something that absorbs the light coming in, doesn't reflect back. So you want to think about that. You know, again, thinking about your contrast of your own clothing, obviously our interpreters here, right, and me too, but how we provide our own backdrop of our work and thinking about the background behind us. So, but I would encourage you to look at the ones for, that are used, that are like, they have very simple pop-up ones that a lot of photography folks use. Sorry, Jen, go ahead.
Now I can't unmute myself. Okay, I think we can stop recording.